Excuse me, can I ask you why you're doing that?
The tide's gone out. It's a really hot day. These surfers will not survive.
But you can't really think you're making a difference, can you? There are thousands of them.
It made a difference to that one.
I'm having the conversation every single day with families that despite any of our newest therapies, there is nothing I can do to save their child. That has not changed in 10, 20, 50 years, despite numerous new chemotherapeutics.
There's only so much money to go around, so rare diseases are usually left behind. And also pharmaceutical companies are not really interested in developing drugs for rare diseases because there's not a large payoff for them.
Our doctor had no idea, even though we were dealing with an ophthalmologist, he had no idea of her type of tumor, in her eye, like it wasn't a suspicion to him.
In rhabdomyosarcoma, although it's rare, it is one of the most aggressive and can be one of the most fatal sarcoma in children and adults.
Once you hear, tumor, cancer, you just kind of shut off. And your mind just starts wandering. My 7-year-old is gonna need chemo and, all the things that come with it. It was really tough to take in. How do families do this? I mean, I have 2 other little ones. I'm working. We're gonna start this journey. I have no idea what is gonna happen.
The only thing that can change cancer outcomes right now are really better drugs. Surgery and radiation therapy have gone to the limit of what they can do, and so we need better therapies, whether it's small molecule inhibitors, chemotherapy, or immunotherapy. We just need better drugs to advance all these fields at this point in time.
She had to be pulled from school because of her immune system being compromised, being hospitalized in and out of the hospital. She'd be upset or she'd be hurting and we'd tell her, but you're Wonder Woman, Sienna, come on, you got this. And it would help. It would help a lot. And Dr. Federman was great with her and he told us that she was gonna be fine. We know October is Breast Cancer Awareness Month. September is Children's Cancer Awareness Month, but it's very rare if you're hearing about it and they're not getting the funding that they deserve and the research that they deserve.
The importance of phase 1 is that a grant of $200,000 or $250,000 can be really enough to get early clinical trial data off the ground to show a signal in patients that this may work.
We started with the drug in the lab, we ran it through the cell lines, we saw the signal. We did additional preclinical work to convince ourselves that the signal we saw was the right signal, and the more experiments we did, the more and more we became convinced, hey, there's something here, there's something we really have to explore. The next hurdle was like, hey, how do we get this into the clinic? We're thrilled that phase 1 has funded us for this clinical trial because for the first time we think we have a really exciting compound that is effective in rhabdomyosarcoma in a preclinical sense. We really had a nice synergy between a philanthropic organization, a pharmaceutical company, and academia working together to really get this drug from the lab to the clinic. And if the trial is positive, people will be excited about it. I bet you the pharmaceutical company will be able to raise several-fold more money to do the next stage of the trial. It's like a seed. You water the seed, it grows, and you will be able to do larger trials and help more patients.
Not even the doctor who told me that it was rhabdomyosarcoma, he didn't know what it was. So he didn't even know how to pronounce it. And that kind of was a shock for me. But then he said that there was a specialist over at UCLA, and that's how I got referred over to Dr. Federman. I remember going through my first big dose, and that was like the worst experience I've ever had. And so I was so scared to get another dose, but this next dose was small. And I think the other patients saw that I was like really kind of like worried, and his name was Nate, and he came over to me. He was just like, yeah, the vincristine won't do anything for you. This is just such a small dose, you won't feel it. And he was right. And I totally didn't feel anything from that chemo, and we just totally hit it off and were really, really close friends. And then from him, I met a whole bunch of other patients. I honestly didn't get scared from having cancer until it was gone, because then I was worried that it would come back. The hardest part about being a teen in the hospital is that you know what's going on, and I was the only one to make it out of my group of friends who I met in the hospital. I think that kind of put me in the perspective that, you know what, even though I have cancer, there's other people who are not living right now, and I'm still alive and I'm still fighting.
We don't wake up one day and think, oh, my child might get cancer. It's not something you ever think about. And one day you might wake up and your child presents with a tumor or some kind of abnormality that turns out to be cancer. Wouldn't you want to know that you could have participated or helped, prevent this, or give the knowledge to the doctors that they need?
You have to be really creative in terms of finding drugs for this group of people who really need, an investment from academia, pharma, and philanthropic organizations, because the government is not really going to fund these diseases.
I think that everyone should have a fair chance. We definitely need a lot more advancement in the field to prevent all these losses, just because one treatment might work for one person and the same exact treatment won't work for the next, and I've seen that firsthand. Children who are just starting their life and they are faced with this huge, horrible thing that they don't even understand what it is. There's just so much more to having cancer at a younger age.
I feel like we're very much in the trenches. We're done with chemo, we're done with radiation, but we haven't had our MRI yet. We know on the outside she looks great. It's very scary because you feel like it's just a ghost lingering, and you don't know if you're the one, your child's the one that's going to get it again. I watch her a lot. I watch her like she's playing, she's smiling, she's laughing. I soak it all in because it's literally the best part of my day, just seeing her present.
I lived by numbers, and I wanted to know what my survival rate was. And Dr. Federman told me, I'm not going to give you the numbers just because that doesn't mean anything. There is a 5% chance of someone living, but there's still that 5% chance. And what if they made it? Everyone has their own story and their own path, and he was right.
Where I hope to be in 5 years is I can go to every patient and family and say, with this non-toxic treatment, you will be a long-term survivor.
We're the ones who are tasked with finding new drugs for patients when the standard therapies are not working anymore. And this is our mission. This is why we exist.
I'm done with chemo and I'm done with radiation.
You're my hero.
On April 16th, it will be my 5-year mark of being cancer-free, and I can officially say that I'm cured.